Hi everyone, my name is Dinesh Sirasena, and today we're going to be talking about imaging the carpometacarpal joint. It's important when imaging the CMC joint or carpometacarpal joint to have the patient in a comfortable and stable position. To achieve this, I often have the patient either lying supine on an examination couch or seated with the arm resting on the examination couch. To expose and open up the CMC joint, I often have the patient rest their arm on a towel. This places the wrist in an ulnar deviated position and therefore opens up the radial border. This can be achieved in both the lying and seated position. When imaging the CMC joint, I typically use a hockey stick transducer. The purpose of this is threefold. One, it provides high-resolution imaging. Secondly, it has a smaller footprint, and this is useful for injections, meaning that the needle has to pass through a smaller amount of tissue to reach the joint. And finally, because of the smaller footprint, it's easier to maneuver, particularly on smaller areas such as the wrist. And this is typically the image that you'll find when scanning the CMC joint. You'll find the first metacarpal, the trapezium, and in between you'll find the first CMC joint. Here's an example of a ganglion cyst emanating from the first CMC joint. As you can see, there's this hypoechogenic area which is coming out of the CMC joint. And the difference between this and a synovitis is that when you apply the power Doppler, you shouldn't see an increase in vascularity for a ganglion cyst. The increase in blood flow sitting above the ganglion cyst represents a blood vessel. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound and how you can use it in your clinical practice. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram, and remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you all very soon.